placing respectful pranams to the lotus feet of His Holiness Jagadguru Dr. Sri Shivratri Rajendra Mahaswamiji and seeking the blessings of His Holiness Sri Jagadguru Sri Shivratri Deshikendra Mahaswamiji, we begin today's programs, to which I welcome all of you. Martin Luther King Jr. said that our lives begin to end the day we become silent about things that matter. Studies have revealed that 40% of the female workers claim to have been harassed at work, as opposed to 7% of men. WHO statistics show that most of the world's population, which is 58%, spend one-third of their adult life at workplace. Workplace becomes our second home and an important part of our life. Hence, this initiative from JSSA HER to organize the Women PAKHWADA on discrimination against women, prevention, prohibition, and redressal of gender sensitization as well as sexual harassment to prevent violation against women beyond the barriers, respect, empower women at higher education and workplace. Good morning to one and all present here. I, Dr. Divya, from the Department of Health System Management Studies, welcome all of you all today. When we welcome people with smile, people enter the place as guests and leave as friends. Welcome to day 6 of the activities from the ICC of JSSA HER. We extend a warm welcome to Dr. Vijaya B., Professor, Department of Pathology, JSS Medical College, and who is the chairperson of the day. Welcome you, ma'am. Dr. Mamta, Head of the Department of Gynecology, JSS Medical College, who is the moderator of the session today. Our esteemed panelists for the day, Dr. Sumana MN, Professor, Department of Microbiology, Dr. Pratibha Pereira, Department of Geriatrics, Dr. Preeti SP, Department of Surgery, and Dr. Bindu from the Department of Psychiatry. A warm welcome to all the dignitaries, principals of the constituent colleges, deans of various faculties, heads of departments, officers of university, faculty members from the various constituent colleges of JSSA HER, my dear students, as well as students in OT2. A warm welcome to all of you all. Today, the topic for panel discussion is Health Index of Female Fraternity, Working Women at 30 plus. As Michael Obama rightly said that communities and countries and ultimately the world are only as strong as the health of their women. Gender equity in the health workforce analysis of 104 countries by WHO states that one woman from 70% of the workers in the healthcare and the social sector. Women representation in the most highly paid health occupation has been improving since 2000. Women are less likely than men to be paid full-time employment, and overall the average gender pay gap is around 28%, which exists in the workforce. So the health and social sector with 234 million workers is one of the biggest as well as the fastest growing employers in the world, particularly for women. Women comprise 7 out of 10 health and social care workers and contribute to somewhere around $3 trillion to global health, half in the form of unpaid workers. International Labour Organization as well as WHO organization states that the most comprehensive global analysis of the gender pay inequalities in the health and care sector finds that women face larger gender pay gap issues than other economic sectors. So in normal circumstances, women generally perform an average of 4 hours and 25 minutes of unpaid care work against 1 hour and 23 minutes for men. Hence, it was found that almost 100 million female workers in healthcare institutions around the world have a lot of balancing work to do with family responsibilities that have always been a challenge. Hologic and Gallup asked 5 questions on the dimensions that take together and account for 80% of variations in the women's average life expectancy in terms of preventive care, emotional health, opinions of health and safety, basic needs, as well as individual needs. These 5 dimensions also track closely with the key global health and well-being indicators that the world has prioritized as a part of United Nations Sustainable Development Goal. The overall score for the Global Women's Health Index in 2021 was just 53 out of 100, 1 point lower than 2020. Hence, it shows that women were more stressed, worried, sad, and angry in 2021 than they were in any other point of the past decade, according to this survey. Experts also agree that we are generally failing women across the world. And they also feel that it is really important to improve the women's health, and which will lead to lifting of the society as a whole. So in India, in 2017, NITI Aayog, in collaboration with Ministry of Health and Family Welfare and the World Bank, initiated an annual health index for tracking the overall performance as well as the incremental performance across India. And the health index is a weighted composite score incorporating 24 indicators, which covered various key aspects of the health performance in terms of health outcomes, governance and information, key inputs, as well as processes. In this survey, they found that Kerala was the best performer, with Karnataka in the 9th position, a position which it moved from 8th to 9th in 2021. Being a man or a woman has a significant impact on health as a result of both biological as well as gender-related differences. The health of women and girls is of particular concern simply because in many societies, they are disadvantaged by discrimination rooted in the socio-cultural factors. Time and health are two precious assets that we don't recognize and appreciate it until it has been depleted. I believe that the greatest gift you can give your family and the world is a healthy you. It is a long time past that we start focusing on solutions that actually keep women healthy instead of using basic aspects of women's health as a tool for cultural, moral, and political control. Now, I request Ms. Nayana and Ms. Sara to introduce the panelists.
Good morning to everyone present here. Today, for the panel discussion on Health Index of Female Fraternity, we have with us the chairperson for the session, Dr. Vijaya B., Professor and HOD, Department of Pathology, JSS Medical College. She's completed her MBBS and MD in pathology from Government Medical College, Mysore. She has a total teaching experience of 26 years. She has been efficiently shouldering the responsibility of reporting dermatopathology slides in the department for the past 16 years. She is also in charge of reporting immunofluorescence of skin biopsies, for which is well established from the past 11 years. She has also shouldered the responsibility of development of Department of Transfusion Medicine. She has also published 40 publications and has also done presentations in various state and national level conferences. She is a member of the International Society of Dermatopathology and a life member of the Dermatopathology Society of India. Welcome, ma'am.
Next, we have with us the moderator for the panel discussion, Dr. Mamta. She is the HOD of Department of Obstetrics and Gynecology, JSS Medical College. She's also an alumni of JSS Medical College. She had been president MOGS Mysore. She has presented papers at national and international forums. She has 23 publications to her credit. Welcome, ma'am.
Next, we welcome our panelists, Dr. Sumana N.N., She is the Director, JSS Laboratory Services, JSS Hospital, Mysore. She's completed her MBBS from Bangalore Medical College and has done her MD from Mysore Medical College. She's the Professor of Microbiology and she's also the Chairman, Hospital Infection Control Committee and CSST in charge in JSS Hospital. She's also a member of the Antibiotic Stewardship Team, JSS Hospital. She has bagged the Mother Teresa Award for Community Mobilization in the International Conference on AIDS 2001. She's also received the Gold Medal Award for conducting the Rural Health Education Program by Global Economic Progress and Research Association India, and also the Mahatma Gandhi Gold Medal Award for Excellence in the field of microbiology at the 34th National Unity Conference. She has presented more than 50 posters and papers in various national, international, and state level conferences and symposiums. Welcome, ma'am.
I now welcome our second panelist, Dr. Pratibha. She is the Professor and HOD Department of Geriatrics, JSS AHER. She has completed her PGDGM from INAI Malta. She is a mentor and head of research center and the ethics committee member. She is also the head of Department of Quality. She is a part of National Colloquium on Elderly Care in India. She has more than 50 publications in national and international journals. She has received Young Scientist Award by API and Double Helical Award for services in geriatrics. Welcome, ma'am.
Next, we have with us Dr. Preeti. She has completed her MBBS from Sri Devaraja's Medical College and MS from JSS Medical College and has done her MRCS from the Royal College of Surgeons, Edinburgh. She has a fellowship in minimal access surgery from Max Institute of Minimal Access and Bariatric Surgery, New Delhi. She has a total of 17 publications to her credit, and she has also worked for UNICEF regarding the immunization and child health. She was the chairperson for CME on thyroid, which was conducted on 20th October 2012. Welcome, ma'am.
The next panelist is Dr. Bindu. She's a senior resident, Department of Psychiatry, JSS Medical College. She has completed her MBBS and Diploma in Psychological Medicine from JSS Medical College. She has 4 publications to her credit, along with 3 chapters published in various books. She's actively involved in undergraduate medical training and postgraduate psychiatry training. She has conducted mental health camps at Hunsur and Mysore, India. We welcome you, ma'am.
Thank you, Sarah and Naina. Over to you, Vidya ma'am, for the session.
Good morning, all. At the outset, I thank the organizing committee for giving me this opportunity to share this session with all these dignitaries who are specialists in their own field and seeking the blessing of His Holiness. I welcome you all to this panel discussion and a very good morning to all of you. So all of us know that in Kannada we say Hennu Samsarada Kannu. This is a woman or a mother or a wife is a main member of the functioning member of the family who keeps everybody together. So all of you know health is wealth. So if the mother is healthy mentally and physically, she can really try to maintain the health of the whole family. And all of us know that many a times women neglect their health. When we take up the statistics also, when we see for so many diseases, women come late to the clinician because they usually try to neglect or postpone their their interview with the consultant. So, and all of us know that since we neglect our health, the nutrition of the women is also not as good as men. Even the HB standards only is lesser to women than for men. And even because of many working women, even it's very difficult for them to have the work-life balance, and many of them are stressed in both the working place and at home. So today we have all the senior people who are going to discuss about the physical, mental, and also the spiritual well-being of a human being, especially women at work. Thank you. Over to Dr. Mamta, who is going to moderate this session. Thank you, Dr. Vijaya. Good morning, everyone. And first and foremost, I would like to thank the organizers for giving us all of us an opportunity to be a part of this initiative by the JSS AHR, which really has given a chance or an opportunity for all the working women to introspect into our life. Are we going in the right way? Are we giving enough time for ourselves? Or in the race, are we lost somewhere? I think a lot of introduction has already been given by your Divya, Dr. Divya, and as well as Dr. Vijay regarding health. So I have really 4 panelists who have got enormous experience in their life. 2 senior panelists, Dr. Sumana Madam and Dr. Pratibha Pereira, of course, in their field of expertise. Also, they have an experience. And we have 2 young and energetic and enthusiastic to explore life, Dr. Preeti and Dr. Bindu, to share their view about what is the concept of this health. See, when I went through the title of the panel, the health index of female fraternity. Of course, women empowerment. I think it all started with our generation. So they started first about women's education. Yes, it's good to get educated. Then they started financial independence for women in the way of jobs, creating jobs. Yes, good. Even that also was achieved by the women because, as you know, women have sufficient power to empower everything. So they achieved that also. Everybody became educated. Everybody started going for work, started earning financially. They became independent. Then they became women empowerment and equality. Yes, we all are today, of course, on equal par with men, no way less. Maybe in terms of multitasking, we are in a way 1 step forward than men. That we all have to accept. I think even men also will accept. In my house, they say whenever 2 things are to be done, they say you better handle it because you can do 2 things at a time. So I can concentrate only on one thing. That is what they say. But somewhere in this race of achievement and empowering, I think we are losing something. Okay, at 30 plus, how many of you are 30 plus over here? I think I see very few over here. Yes, good. So in this way of achieving everything, there is something which we are losing also. That is our health. As Dr. Vijay said, probably the health also has a gender discrimination because we bother about our husband's health, our in-laws' health, our kids' health. And in the last thing, the priority is my health. If I have to go for a test, everybody in the family thinks, oh, for what? For her, every day she goes to hospital, she can always get checked. But we go to hospital as a healthcare provider, not as a healthcare seeker. Okay, for us to take a decision to seek health, by then it would have been too late. So this is just a panel is mainly focused on just to make you people aware that when to start getting your health, worried about your health, or take care of your health more than worrying. So my first question to Dr. Pratibha Pereira is, ma'am, in your perception, what is the concept of health?
Hello. It's yeah. See, there are 2 things here: concept of health, and the next is definition.
Definition.
So whenever we look at concept of health, I think it is, to me, it's individual based. It depends on what you think is health. All right. Most often, we look at concept of health usually based on certain parameters. If my hemoglobin is 13 and I do not have diabetes, I don't have hypertension, and I don't have, so our concept of health mainly be akin to the lab results. So we go for checkups. So we get all the lab results done. But then to me, that is the least important part of concept of health. To me, concept, if I think I need to have total focus and total attention, enough energy to deal with whatever I am doing with my day-to-day activities. And when I get up in the morning, I get up with energy, not only of body, but of my mind. And I need to sustain that energy throughout the day. To me, sustenance of energy and keeping up the enthusiasm and ability to do whatever I need to do with equal attention, to me, that is health. And trust me, there's a big gap between having normal lab results and feeling this, what I told you just now. At the end of the day, why is it so concept of health is different for women is because we multitask. So we need to develop our own ability to deal with multitasking. So to me, that's concept of health and not the lab results.
Then how do you define health, ma'am?
I took out definition means look at WHO. So I said, because normally I'm completely against definition in which I don't believe. Now I'm going to read to you WHO definitions, okay? Because we go by WHO definition. Nobody really has given a definition of health of women. Is there a definition? No,
There isn't, because each one has an
so we can
individual-
create one definition for ourselves.
Yes, definitely.
Okay, so but general, end of panel discussion will define health for women. All right. Now what WHO says, health according to World Health Organization is a state of complete physical, mental, social well-being and not merely the absence of disease and infirmity. A variety of definitions is also used for purpose. Okay. Mainly, this is the definition of health that is given. So it is not only physical, it's not only mental, it is also social well-being. So that is the accepted WHO definition. Now, what I came as concept of health, I had just now read the definition, is that most often our health, definition of health is there, but when we look at concept of health, it is not reaching there because two parts, that is especially social well-being and mental well-being, is not considered at all as a part of health. Thank you.
Thank you, ma'am. See, whenever a person says, I am healthy, yes, what do they mean by that? Is it just as Pratibha madam said that all their parameters are within normal limits? A person with hemoglobin of 8 also looks normal. A person of hemoglobin 30 also looks normal. Sometimes even hemoglobin of 5 also will be walking around normally only. So health, definitely, there has to be some index and criteria to say whether is this person healthy, physically, mentally, as well as socially. Even that also sounds. So Dr. Sumana, what is your concept on health index? Do we have any criteria to assess the health index?
Health index is a number which measures the health of the individual over a period of time and how it changes over a period of time. Ideally, health index should be given, but out of the so the health index is a number which determines the health of an individual over a period of time or a population over a period of time. I think it's not working. I think I should hold it very close.
This health index ideally should be above 80 to 100. But please remember, none of the countries across the globe, out of the 195 countries who participated in calculating the health index, none of them have above 80. The highest of the health index we see in US, and then Canada and Australia, and various other Western countries. And India stands at the rank of 66 out of 195. And it varies from 40 to 60 over a period of time. So we need to improve upon our health index, and especially the women health index. Women health index has not been defined in any of the countries, but because more and more women are coming to work and they face a lot of challenges in the workplace, along with the challenges they face at home. So there is a separate health index that needs to be calculated for the women health. And this health index as a whole is calculated on various parameters. Most of them, the mortality rates at different age groups, and the nutrition of the population, and various health facilities, and the rate at which the common infections are required. So some of the mortality rates that they consider at for this health indexes, the mortality, neonatal mortality rate, infant mortality rate, under 5 mortality rate, and then general mortality rate. So like that, the different mortality rates are taken into consideration. And as far as the nutrition is concerned, the stunted growth below 5 years, and then obesity below 5 years, and adult obesity, which is a major problem as of today, because we have excess food and we're used to eating junk food, not exercising, the sedentary work life, and many of the people who work in the computer field or IT field, the sedentary lifestyle, all these are taken into consideration. Not only underweight, overweight also is an indicator of health index. Then along with that, the infection rate of tuberculosis, because in our country, we have to take into consideration tuberculosis, one of the commonest infections that we come across. And then number of tuberculosis cases for 1 lakh population, and number of HIV positive cases for 1 lakh population, and the number of antenatal women who register themselves in the healthcare system in the first trimester of pregnancy, and what is the amount of facility available in the primary healthcare centers. All these are taken into consideration for calculating the health index. In our country, we stand at position 9, and we have moved from position 8 to 9. Karnataka, that means Karnataka. The highest is seen in Kerala, as mentioned by Dr. Divya. And the South Indian states have a good health index, but Karnataka, though an advanced and a rich state, stands at level 9. Recently, I saw an article in the newspaper saying that though a rich state, but the indicators are poor. There was an article in Deccan Herald. So we need to improve upon our health index, for which all of us will have to work. And especially the health index of women. We all have to define, because we need to have extra parameters to define the health index of women. So at the end of the panel discussion, we need to put down some of these parameters that have to be taken into consideration for calculating the women health index. So thank you, Dr. Mamta.
I think probably the Kannadigas are working more towards making the state richer than making it more healthy. So I think definitely, because when I also went
That's
through
true.
that Niti Ayog, what I found is Kerala was I think many of the Keralates will be here, because our university, of course, has a good number of Keralates. So Kerala stands first in the health, of course, first in many things. And to my surprise, I found Andhra Pradesh and Telangana in the second place. And we stand 9th. So it's really,
Can I
I think we
just
need to work
make
in
a
this.
Joke on that, why Kerala stands first?
Tell me
It's matriarchal society.
So let's get serious into this. Now, I think Madam was telling about mental health. So Dr. Bindu, we have our psychiatrist over here who can just enlighten us about what do you mean by a healthy mind? Which probably it's very confusing. For somebody who is healthy, mind may not be healthy for the other person. So can you just enlighten us on that?
So, as Madam said, mind is very complex, and that's the reason all humans appear complex. We don't understand one another. There have been various attempts to describe a healthy mind or normality, but in vain. So they have from time to time come up with various models which talk about one aspect like absence of psychopathology. That means absence of symptoms of psychiatric disorders. That was one model that was proposed, but it was not sufficient to describe a healthy mind. Then they said having adequate coping mechanisms, being able to reasonably function every day. Then biologically speaking, the maturity of the brain, that is the myelination of the brain, which slowly begins during adulthood and progresses throughout life, attaining emotional and emotional intelligence through the experiences is a healthy mind. Then it was also said that being empathetic was also a manifestation of healthy mind. So there have been various attempts like this, And none of these seems complete. But I can say all of these put together makes us healthy emotionally, mentally, so that we can function adequately on a day-to-day basis.
Thank you, Bindu. I think Dr. Preeti, see, till now we were talking about health index of working women, health index of working women. Does it mean that homemakers or those who don't work, are they really healthy? Or is it really, there is some difference between the working woman's health index and the homemakers? Will it have an impact on their health?
Yeah, I think it is all about work-life balance, whether we are working in the office or at home. All of us women are working. So we need to focus on some important things which are very basic but mostly ignored, like diet, exercise, stress management. So if you're not focusing on diet, not able to cook at home, eating outside food, it can lead to problems like gastritis, gastroenteritis, infections, and if you're not taking the appropriate food, like missing out on high fiber diet, we can end up with constipation, problems like hemorrhoids, fissures. Not drinking water adequately can lead to urinary stones, urinary tract infection. And this is not just limited to working women, it can happen to homemakers also. Similarly, exercise. Lack of exercise can lead to obesity and consequent medical problems like diabetes, hypertension, and surgical problems like hernias, gallbladder stones, and again, stress. So there is definitely a lot of stress both at working place and at home. So at workplace, we are focusing more on improving our performance. It may be our performance in relation to our colleagues, or it may be with our own past performance. There is always a stress to improve upon it. Similar things can happen at home. Somebody is trying to be the best mom, best cook, best wife. So they overwork, they overdo, they take a lot of stress. This can lead to a lot of problems like depression, anxiety, sleep disorders. So I don't think it is limited to working women alone. Working women in the sense those who work outside. It may be at home or at workplace.
I think that's a good point. So I think when one of the headings in this is working woman at 30 plus. So when I looked at this number 30, I was wondering, because earlier, a few years ago, when they used to invite me on Women's Day for some of the lectures, they used to tell me, madam, you just tell how to take care of health for women after 40. And now university has set the age to 30. So good that a lot of women in the younger age are working, and indirectly they're telling, please take care of your health, be fit to fulfill our requirements. I think Dr. Kokila will agree with this. So they want all of us to stay healthy and fit to take challenges and improve our performances. So I think that's a bit of a challenge for 30, because 30 is the age where people start their reproductive life, their marriage, they start having families, they start achieving by then you would have completed your studies, you would have started working. So it is like a multitasking, as you said, you have to balance your family, you have to balance your work, you have to achieve here also, you have to convince everybody at home also. So I think 30 is the time when we need to really talk about taking care of health. So Dr. Pratibha, what do you think about this shift of this age from 40 to 30?
The present, they say, is the present, the earlier 50s, present 30, earlier 60s, present 40.
Yeah, that by looking at you, we can
that has
always agree that.
happened. I guess it is, various factors are affecting why the shift. I guess one, it is looking at, the peer pressure and the pressure of getting, I'm talking about women now. I'm not talking about the men, few men who are sitting here and there. So not about that. I'm talking about women. See, we have also got into the field of pressure double. It's just because we are educated, we are working, that does not absolve us of a family pressures. So they say something, no? It is something which is accepted. So it is taken for granted. No matter what you do, you have to take care of the house also. So we have added burden on dealing with stress. outside and inside, which was not there in our mothers and grandmothers. They were very happy doing one thing, that is home. And whatever frustration they had, they wait for the daughter-in-law to come into the family. And then they had a went out. Okay, so kabhi saas bhi, kabhi but all sorts of things. So they kept their mind healthy because somewhere they took it out on someone. She waited for her daughter to come. But now that's not so. We are exposed to all the stress of professional life and all the stress of family life also. So both. And other part of it is, I think somewhere there is adulteration and environmental pollution, everything which is taken care of, which is acting. And added to this, women have one more which they have to deal with. They're not giving enough time for themselves to rest. Is during our menstrual cycle. Earlier days, you had to sit out 3 days, rest. We're not doing that. Actually, our immunity drops very much during that time. But we are working even more during that time. And then, say delivery and after delivery, we are not really giving that enough time for our body to. These are two huge stress which women have to face, which men don't face. And these are two areas we're completely just neglecting, that these are the two areas I need to take care and concentrate. So today's women, there are myriads of things that has changed for us. And that is why I feel not only 30, I think shift to 20 and start building your health from 20.
20 to 30, I think the issues are a little bit different over there because they're still studying and youngsters. Maybe the challenges, what they face may be different. But 30 and above, I think we can make a differentiation here that between 30 to 40 and 40 and above. That above the upper limit can go up to 100 also. We have many centennials also over now. So, and geriatric departments, Pratibha madam, as long as is there, she'll take care of all the older people and keep them healthy.
So what she said, 60 plus is now 40 plus. So we all have to go to Pratibha madam for any health issues. Okay.
So,
And as far as the,
yes, ma'am, you can continue.
yes, the health at 30 plus, they talk about. What I feel is health right from birth, I feel. Any individual, maybe leaving the children out or infants out, any age, you have to give time for yourself. And there are many women here below 30s. Just that you're studying or doing something doesn't mean that you should not exercise. Any age, you require exercise. So that fitness is what is very important. You may be thin, you may be fat, you may be obese, whatever it is. All ages, I feel, you should exercise. At least half an hour a day, you should give time for yourself and keep yourself fit. Need not be the looks wise, at least for fitness, everybody should do the exercise. And along with that, as long as the health index of women 30 plus is concerned, 30 plus is the age at which many of the women, start marrying now. The marriable age is increased and 30 plus they get married and they settle down, and 35 plus or 34 plus sometime during that, they have to conceive. And that's the time when they get into the new jobs. They would have completed their studies, they get into the new job. And when they get into the new job, many places they don't give the maternity leave because you are the newcomer or you have not completed your, what is that called as probationary period. You have not completed your probationary period. You're not given the maternity leave. So what to do? So women are under stress there. And for that sake, they want to settle down in their career and then postpone their the first issue that they want to have. So this is an important impact as 30 plus women we have to look into, and we have to, recommend to whatever committee, whatever authorities that even if they're newly joined, they shall be given the maternity leave. They should get all the benefit. So their career gets postponed otherwise, or their family extension gets postponed. So we need to concentrate on this. And for women who are very young here, below 30, vaccination, we're going to talk about it later. Okay, I'll talk about the vaccination a little later. I hand over to Dr. Preeti.
I think this problem starts very early, in fact, in childhood, especially with all these competitive exams coming up. You know, when we were kids, we would come back from school, refresh, eat, play with friends, and then start studying. Now, what is happening? All this, many of these centers like BASE and Akash, they start all this training for competitive exams from 6th standard. So the children are losing out on their diet practices, exercise, playing games. So this leads to onset of obesity at an early age, say childhood or teenage obesity. There's a lot of changes in the lifestyle, and this continues with, once we take up job. So I suggest we set up the realistic objectives. If I try to be the best surgeon in Mysore, the person who does the maximum surgeries or the richest surgeon, is it practical? Is it achievable? There is already somebody, there is always somebody who will be doing better than me. Even if I achieve it, at what cost? At the cost of my family and health. So we need to introspect and set some realistic goals so that it doesn't affect our lifestyle and health.
Bindu, does the mental health has any difference in the 30 to 40 and 40 to above? The problems what they come up with?
30 and
30 to 40 and 40 and above.
Okay. So most problems at all ages are the same when it comes to women's mental health, in terms of experiencing premenstrual syndrome, depression, anxiety. We all know that depression and anxiety are more commonly found among women. Now, in those women post 50 or so, we are concerned more about the menopausal symptoms. So menopause comes with a whole lot of changes in the physiology, the physical aspects of the individual. The emotional health of the individual is affected because of menopause, because estrogen is known to be protective in terms of mood and anxiety. So this also has a protective effect on the brain. It is known to be neuroprotective. It affects plasticity, reduces degeneration. Now, when that comes down, there is a whole lot of change in the entire body, leads to more incidents of depression and anxiety. Another important aspect is the decline in the cognitive function of the individual. So when I say cognitive functioning, I'm talking about attention, concentration, memory disturbances. So the onset of cognitive decline may be seen after menopause. Now, I'm not saying that everybody who attains menopause will begin to have memory disturbances or there is a decline in functioning. What I'm trying to say is this also has a role here, but the cognitive functioning of any individual is affected by multiple factors. That is the education, the continued physical activity, the mental stimulation of the individual, the coping skills of the individual. So all of these have a role along with these biological changes. So this is one more aspect that is different in those above 50 compared with the ones who are in their 30s. Now, there is also the concern of substance dependence in women, where there is again a changing trend in the substance use among women. We see more and more women consuming alcohol, smoking, cannabis, etc. So this also has led to a major change in the pattern of lifestyle of women. This probably comes from peer pressure or having a sense of power or control, curiosity, wanting to be equal to men, wanting to do what they did, maybe various factors. What is important is where do we draw a line between social drinking and then entering a point of dependence. Again, we have to look at what led to the consumption of alcohol or other substances. Sometimes individuals experiencing anxiety, depression, or any other emotional disturbances can also resort to alcohol for comfort. And it can also lead to dependence, and the way women handle substances is very different from the way men handle substances. I mean, the body, we have lesser capacity to metabolize and break down the substances compared with men. So it affects our bodies much more than it affects the bodies of men, or the physical health of men. So in this regard, there has been a lot of change.
I think there are a lot of intrinsic as well as extrinsic factors which influence both the physical health and mental health. So we need to be aware of all those things. So as now, I think as an obstetrician, I would like to mention over here that early menarche, like earlier girls used to attain puberty around 14 to 15. Now they've started, it has shifted over to 8 to 9 years. So probably it is early menarche, early influence of hormones. It, of course, hormones do play a role in the functioning of everything, in especially cellular aging. So all these things are predisposing us to many diseases to have at an early age. So I think women, of course, the different health of a man and a woman makes a difference in their years. Very early years, of course, adolescent, childhood, of course, is common for both infections and that. But once they attain puberty, it is mainly the hormonal influences, the PMS, the anemia, and those things, and PCOS nowadays, obesity, the lifestyle. So I think adolescent period, they are, of course, predisposed to many diseases. And then during, once they get married and start thinking of reproductive career, then it is the abortions, the delivery, the pregnancy, they predispose them to make them at risk for developing many diseases. And later between 30 to 40, of course, there are few diseases which are more common. And after 40, the onset of menopause, that itself again comes back to the hormones, lot of variations, and added upon that, the metabolic diseases. So all these things puts women at a higher risk. Earlier, IHT among women, the MI among women was very less. I think nowadays it is becoming more common. Angioplasties, angiography, I think it's more common among women also, almost on par. Probably it all depends on our lifestyle, and it is not just genes which determine. You also have a role to play here. It's, don't blame your parents or your grandparents for any disease with whatever happens to you. Definitely, we also have something to do with our own body and mind. So I think, so is it possible to prevent, ma'am? Now we know that at 30 we are getting all these things. Can we do something to at least stop this?
Absolutely. Now, you know what, prevention and promotion of health is really gaining a lot of momentum in, across, and women majorly. The one thing what happens to us is that where we lack and discipline among women is basically exercise. We do not give importance to exercise, and invariably we will be developing the central obesity, and therefore the metabolic syndrome X, what we say, just overtakes and overwhelms us. So upfront, it is our discipline to exercise is not there. Physical exercise as well as mental exercise. We think working in the house, washing the plates and this and that, that is no. So we all have to first upfront, prevention is you keep an ideal body weight of yours. That is very, very critical and important. Height in centimeters minus 100 is your weight in kgs. Always see that your body weight is well kept when you're about 30, 40, because what happens is our body, basal metabolic rate really drops. So as we go 40, 50, even 2 extra Mari biscuits, over a period of month, you will put on 2 kgs. It's so much variation of basal metabolic rate when you're young and when you're old. So we never ever keep that in mind at all. So upfront, the first role for prevention is keep your body weight under control. A lot of your problems will get solved with it. And then, yes, various types of exercises is very important. Okay, you do aerobic exercise, but a very important thing is that you do exercises which are isotonic also, which will build up the strength of your muscles, which is important for women. Okay, high aerobic exercises is okay for 20, 30, but you want to prevent a lot of things, you have to go for a good isotonic exercise. So pattern of exercises will definitely help you control. And next is the mental strength. Okay, so a lot of things are there. I'm not saying do meditation. You sit meditation, 1,000 thoughts keep coming in, and that is even more stressful. Okay, then all who have insulted you, this and anger, everything comes. Don't sit. Okay, I'm going to leave. It never happens. Okay, all right. So just go to yoga. And for me, meditation is just do one thing at a time, even if you're multitasking. Suppose you're cooking not with the mobile and So there are certain things where I'm talking about prevention. We don't have time, but prevention of depression, loneliness and mental, and prevention of body illness. So as we grow old, we get one package, diabetes, IHD, and as she said, not far behind. Added to that, women have a few more. That is very bad news. You'll see by 45, you'll see women walking, waggling. You see across, and one thing that is neglected is your knee joint. So as I say, after 50, you want to prevent anything that comes with it. You want to prevent further morbidity, and you should take care of your knee more than your face. Don't let your face after 40, 50, you take care of your knees. So, and apart from that, diet. We just don't know what is good eating. The pyramid shifts as we go from the age. So concentrate on your diet. There's a shift of pyramid. That means we get butter, we get, a lot of fruits, vegetables. Carb is very less. Okay. So in your plate, 30 to 40, as you shift, you want to prevent lot exercise, a kind of meditative exercises like yoga, and then diet. That is very important and very critical. Shift from high carb to vegetables, and a good protein diet will help us. Of course, sleep is a gift from God, but there are various methods to have an appropriate good sleep. Don't use WhatsApp after
11 o'clock.
10 o'clock, 9 o'clock, whatever. So good sleep is necessary. So diet, hydration, sleep, exercise, mental stability as well as physical. Keep our weight under control, eat right. Lot of your problems can prevent it.
That means you would like to say that a disciplined lifestyle will definitely help you to prevent a lot of things. But one more suggestion as an obstetrician I would like to give here is many of our young women will have hypothyroid, diabetes, and hypertension during pregnancy. But we obstetrician do counsel them, once you deliver, everything will be fine, don't worry. But definitely it is not so. Few of the women may continue to be diabetic, may continue to be hypertensive after pregnancy. So definitely you need to keep a follow-up, not just go back to your obstetrician or your physician by the only when you become pregnant for the second time. That doesn't hold good, because these things can also make you prone for developing all these diseases at a later date. So 30 to 40, definitely, especially all these metabolic things and hormonal abnormalities, you need to be concentrated. So Madam, would you like to add anything over there?
Yeah. One more thing that I would like to add on is, I remember our hospital director, Dr. Dayanand, before he retired, he left our hospital, he came to our department for lunch. He said, because we're all full of lady staff in microbiology department, he said, one thing that I would like to advise you all. He said, give some time for yourself. Not only doing the exercises, whatever hobbies you want to pursue, that will improve your mental health. It will make you forget so much of your stress that you've gone through in your workplace or at home or wherever it is. So give some time for yourself, whatever may be the age, give some time for yourself. Do something that you enjoy doing. So that will definitely improve your health. And you'll also get a lot of confidence out of that.
I would suggest a life of moderation. Life is not a rat race. It is not a single track. It is a total package. We need everything, a bit of everything, a bit of career, a bit of family, a bit of friends, hobbies, travel. So we need to do all these things and set ourselves as a priority.
So if we have to understand how to prevent something, we have to first understand what is really causing it. So when it comes to emotional problems, psychiatric disorders, there are different aspects, that is biological causes, psychological causes, and social causes. Now, biological could be hereditary, where some of the conditions are transferred from the parents or the grandparents to the younger generation.
psychological causes like the personality makeup of that particular individual, the thought process, the thought pattern, and the manner in which we react to those thoughts. And then social problems. Some of these are modifiable and some not modifiable. Like biological causes, hereditary, we cannot modify any of that. We cannot modify the neurotransmitter changes that occur in the brain, which are leading to some symptoms of psychiatric disorders. Psychological aspects like the personality makeup, to some extent, can be worked on. Now, there is this concept of emotional intelligence, and under this, we talk about, first of all, understanding our own emotions in every situation, being able to regulate those emotions and react in an appropriate manner. Third is having empathy, that is able to put yourself in the shoes of others and understand their situation. The fourth is having adequate social skills to get about, to communicate with people. Fourth is, fifth. The motivation. You have to find out what really motivates you to do something. There may be superficial motivations like money, power, and name, etc. But you have to really find out what really makes you happy, makes you motivated to pursue something. Only then you will be able to make appropriate choices. Now, another thing that has changed is the overly protective parenting that we notice these days, where children are not given an opportunity to solve things on their own or face adverse situations on their own. So basically what happens is everything is solved for them. So they grow up with the concept that everything will be done for them and they just have to live. That does not help. We have to give children an opportunity to face adverse situations on their own, make decisions, face the consequences with the direction of the parent. So this is just like our immune system. If our immune system is challenged by infective agents, our immune system becomes active and is ready to face anything that is going to come in the future. In the same way, our coping skills are honed. They get better and better when we face the adverse situations on our own. Older people are much stronger than younger people because of their experience, because of their ability to understand their emotions and regulate. So these are some ways of understanding ourselves and preventing the onset of different psychiatric disorders. The other thing is exercise has been highly emphasized on. So PMS has known to respond extremely well. The physical and the emotional changes that one goes through during premenstrual period have been known to extremely respond very well to regular aerobic exercise. And this is not like you start a week prior to the periods and then stop after that. No, it is a cumulative effect. So regular aerobic exercise 4 to 5 times in a week is known to bring down all the physical and emotional disturbances of PMS. So these are some of the ways of preventing.
I think there were good valid points over there, Bindu. Of course, I think the youngsters in the gathering are thinking this is not for us. The girls less than 30. So now let us get serious. So what are the recommended screening tests at 30? Because earlier when we used to speak screening 40, but now there are some recommendations for screening tests which starts at 30 only. Pratibha madam, what are the medical tests which you recommend for every lady who achieves 30 to go for a test?
I think it's the standard. You screen for all the metabolic diseases. You have diabetes, hypertension, but I think you screen for your vitamin D deficiency. That is a must for women. Vitamin B12, go ahead with hormonal assessment. And as you grow up, of course, you screen for cancers. So that is important, especially women. You will have to do pap smear, look for cervical cancer, breast. So I think because we have to pick it up early, there's always adequate research and treatment options that they can really have a normal long life. So, and they have many times I feel very sad women shy away when a breast lump comes, and they come and you cannot do anything. They hide it. So I think we need to educate women on treatable malignancies and not to shy away to come up early. So because the breast cancer is something which will hit at 30, 40 also. I think we have to educate them right now how to screen, and that's important. And next, of course, you screen for any, usually undetected urinary tract infections and things like that. So overall screening is for metabolic malignancies, deficiencies. So we can divide it into 3 parts when you need start to look at for prevention and screening tests.
So just because we recommend you to go for a routine health checkup doesn't mean that you're getting older. It's just that you are assessing your health index at an earlier age so that you know where you stand and are you at risk of developing something, and you can definitely start acting earlier so that you can prevent it later. So as an obstetrician, yes, of course, pap smear at 40 we used to speak before. Now it starts from 25. I think Dr. Sumana will give you more details about that later. And self-examination of the breast and everything, which you can do at home only. You don't have to feel shy to go to anybody. That also has been, people have started educating our younger women for that. And regarding, as Pratibha Madam said, regarding the metabolic diseases and obesity, so just get your vitamin D, thyroid, hemoglobin, of course, and routine things at an earlier age. And of course, one more thing, lipid profile. Cholesterol, every woman nowadays, they come and ask me, Madam, can you just get me a cholesterol test done? You give her high cholesterol, she won't stop eating other things, but she just wants to know her cholesterol level. So I think all these things we need to just go for a routine checkup. There is nothing wrong in getting these tests done at 30 also. So Dr. Sumana, what would you like to suggest about pap smears?
Yeah, pap smears detect the early cancers or in situ carcinoma of the cervix. But we have another test where we do molecular tests. The cervical swab is taken and we do molecular tests and detect if the human papilloma virus is present in the cervix or not. And also we do what is called as genotyping. And based on the type of the genotype we have harbored in the cervix, it can predict whether you're going to develop this cervical cancer in future. So this is a much earlier test compared to the pap smear. And that also we are planning to introduce it in the master health checkup panel. So that will help you to prevent, even before it becomes an in situ CA, this can prevent maybe by vaccination. Vaccination part will be taking up later. All women below 26 years have to be vaccinated for human papilloma virus. 2 or 3 doses of vaccine have to be taken. So there are many women here below 26 or below 30. Please remember the human papilloma virus vaccine is very essential to prevent the cervical cancer in future.
Oh, even today, the cervical cancer is the most common cancer what we found in our Indian population. So I think whatever we say, we have advanced in health, that is. Even today, every month, at least in our OPD, we do find 2 or 3 cases who come in the 3rd or 4th stage, which is definitely not a good indicator. That means somewhere we are, our screening methodology is failing. So I think that's why the Indian government has recommended to take HPV vaccine starting from the pediatric age only. But ideally, probably once you attain menarche, between 12 to 16 will be very ideal to take the vaccinations. So whoever are below 20 here, please do come for vaccination. It's easily available and there are no side effects. Please get yourselves vaccinated for that. It definitely gives you 100% coverage. If not, I'm saying you boldly here 100%, nobody gives you a guarantee of that. But yes, of course, because having a carcinoma, going for radiotherapy, that is the worst part of your life.
And
so
one more,
to get it vaccinated.
Yeah, one more thing that I would like to add on is, apart from the nutritional, the screening test that you want to take, see, regular exercise can postpone osteoporosis. Regular exercise, please keep this in mind. Youngsters, when below 30, regular exercise can postpone osteoporosis. And along with that, you need to take care of your nutrition. Good amount of calcium and vitamin D is very essential.
Preeti, can you suggest, recommend some screening tests in your surgical specialty?
See, most of the investigations have already been covered.
Yes.
What we are focusing on, what is called as self-examination of the breast. So younger women face benign lesions, and the elderly age group we see more of malignancies. The important thing is breast diseases and thyroid diseases, they have a very good cure rate, even if it is malignancies. So the important thing is to catch them young, catch them at an early stage. So all those ladies who come to our OPDs with any breast lump, so whatever is appropriate for them, that is advised. Apart from that, we teach them how to do self-breast examination. And we also tell them to teach the same to their female relatives at home, be it their cousins, parents, mothers, aunts, grandparents, whoever is there. We teach them, we tell them to teach the same techniques to all the ladies in the family so that we can, the ladies can present to us at an early stage. So this is what we are trying to focus on.
Here, as an obstetrician, I just would like to say a thing that pregnancy, I think most of our Indian women, pregnancy is an unplanned thing. It's a happy surprise event for them. But nowadays, no more, that surprise can never be, need not be happier all the time. This surprised, unplanned pregnancy can put you into lot of stress for you as well as your family, and the outcome also will get affected by that. So my suggestion to everybody is, whoever is planning for a pregnancy, please go for a preconceptional evaluation, which definitely will help us to identify if you have any high risk factors, which is going to make your pregnancy more complicated. So we can deal with them. We can bring you to the healthy status, have a good control of everything in spite of having some diseases. Then you enter pregnancy in a healthy state, which will definitely help you to have a better outcome of your pregnancy. So preconception counseling and evaluation is a must nowadays, so that you can make your pregnancy more happier and healthier. So Bindu,
in all
I
this
always have a doubt.
one
Yes, yes.
area when you said the preconception, I think thyroid is one very important disease. I think everybody needs to go check your TSH, and even if it is slightly elevated, do your antibodies. You will not know how many really you will have hypothyroid, and trust me, that has a lot of effect on your health in future. So don't forget
It's
thyroid.
not just our health. I think if you want to have a baby with a good IQ, because it definitely, the hypothyroid during pregnancy and during embryogenic period will bring down the cognitive function of the offspring. So that really later you don't have to feel bad for that. So definitely go for it. Bindu, I always have a doubt. Do we have any screening test for mental disorders also? Or is it just the suspicion or the suspect? Yeah. You have.
So there are no prescribed screening tests as such which can be used. But then what could be recommended is that screening can be done at school level. There are some questionnaires which can be used, and children's behavior can be noticed. Teachers can be trained to pick up certain behavioral changes in children. That is what we are actually doing from our department. We are working on school mental health. We are going to train the teachers to recognize common psychological problems among children and get them, either they can help them, if it is possible at their level, or they can be referred to the professional for further management or evaluation. So that can be done at the level of the school and college. One more thing which can be done for the elderly women post-menopause is to screen for mild cognitive impairment, where they can be recognized early, and cognitive remediation can be recommended for them, so that the progress towards dementia can be prevented.
That's good. See, the one more aspect of complications nowadays is what we hear. Many of the youngsters who are moving in for bariatric surgeries to lose weight, cosmetic surgeries to improve their overall appearance. So they're more worried about that, and they venture into all these things. And some few of the reports have given that there are few deaths also following all these things. So Dr. Preeti, can you suggest us, is it safe, or who should go for it?
Bariatric surgery is a surgery done to treat obesity and some associated problems like diabetes, hypertension, sleep apnea. So there are some definite guidelines as to who should undergo this surgery with respect to age, BMI, associated medical conditions. But all said and done, the natural methods are still the best ones. Like we focus on diet and exercise. So we advise the patients to follow a regular diet, go for regular exercise, and try to, reduce obesity with these methods. If these fail, then only we suggest surgery. There are different surgeries like sleeve gastrectomy or gastric bypass. But we need a very motivated patient. That is not a magical surgery that you go to a surgeon, get surgery done, and in few weeks you'll become slim and trim, and all your other problems like diabetes and hypertension is taken care of. So it needs a lot of motivation, dedication from the patient, and there's a lot of post-operative care required after the surgery. It's a teamwork. You need a physician, dietitian, physiotherapist. So you need to listen to what they say, and whatever advice is given, it has to be followed. And later on, once the patient reduces weight, again, there will be cosmetic problems like sagging of the skin. So again, there is a role of a plastic surgeon who needs to take care of all these problems. And just talking about cosmetic surgeries, a lot of developments have happened in the past few years. And things like when we were kids, we have seen a lot of adults with cleft lip. How often do we see them now? So these are few of the common surgeries that are done which can improve the quality of life. Cleft lip, cleft palate, and other problems like scar revisions, nose job, and even after injury, tendon transfers. A lot of procedures are done for faster healing of the ulcers so that the patient can come back to normal life and continue with their job. So this is the role of cosmetic surgeries in the present era.
So what Dr. Preeti would like to convey is, of course, there are a lot of surgeries which are available, but they are all not very safe. So you have to go to the right person to find the right indication and what they suggest you to go through the right procedure, and of course a good follow. So don't believe some advertisements and or whatever it is and rush in a hurry and go for a surgeries, because a lot of complications are there which may affect your future health also. So Dr. Sumanam, were there any vaccines which are recommended for in this age group, 30 to 40?
Yeah, vaccination is the most neglected health
Among adults.
among adults,
Yes.
especially. Children, of course, everyone knows that if the mother is very anxious and so she'll take the baby to the doctor and get the vaccinations done. But adults, as healthcare professionals, we ourselves are not taking the vaccines. There's so many adult vaccines recommended, especially with so many diabetic patients coming up, because India has become the diabetic capital of the world. And so many health style or lifestyle diseases that have come up. Vaccination is an important component of our health and preventive aspect also. Especially pregnancy, MMR, if it is not advised, I mean, it is not taken, MMR is advised, and even DTaP, that is DPT vaccine, which can prevent diphtheria, pertussis, and tetanus. You may tell, why are you talking about diphtheria and pertussis at 30 plus and all that? Now, the adults are becoming more and more susceptible because children are covered with all the vaccines. And now with the waning immunity, adults are becoming more and more susceptible to all these diseases. We see diphtheria in adults. We see pertussis in a 1 month old baby. Recently, about a week back, we have isolated Bordetella pertussis from a baby who had this cough, pertussis-like cough. And it was because the mother was not vaccinated for DPT, when the pertussis. So that's the reason DPT and MMR also need to be taken. Along with that, if any comorbidities are present, like diabetes and asplenia and problems with the lung and kidney and liver, we need to take vaccine for pneumococcal pneumonia, prevention of pneumococcal pneumonia, pneumococcal meningitis as well. Flu vaccine is advocated every year during the cold season, this particular season, but that's also not being taken. So, and even zoster vaccine, 65 plus, zoster vaccine has to be taken. Varicella vaccine, if you're born after 1980, you have to take 2 doses of varicella vaccine as well. So these are some of the adult vaccines that we advocate to prevent various diseases that are commonly seen.
Thank you, ma'am. That was a good information.
Hepatitis B for healthcare workers, of course. I think everybody is vaccinated for hepatitis B. And at birth, it is being advocated now. So if you have not taken hepatitis B vaccine, you need to take hepatitis B vaccine as well.
Now, till now, we have spoken about physical health, mental health, and lot of other things. Dr. Bindu, there is an entity called sexual health also, which can predispose to many other spaces as such. So, can you just emphasize on sexual health among women?
So, in all these years, the sexual health of men has been focused more on. There have been very less studies on the sexual health aspects of women, the sexual needs of women, and the distress that they undergo in this area. But then of late, there has been a little more emphasis on the sexual health of women. There are various disorders related to desire, arousal, and orgasm. There have been conditions like dyspareunia and vaginismus, that is pain during sexual intercourse and so forth. Uh, there have been problems with libido. Now, all of these aspects can come either due to a primary psychiatric disorder, that is depression, anxiety, or these sexual health problems or sexual dysfunctions can predispose an individual to develop depression, anxiety, and so forth. Now, all of these can have many factors playing a role in them, that is, relationship issues, the perception of the importance of sex, the perception of their own physical appearance, the self image of the individual, and so forth. Now, there is another important aspect about sexual abuse among women. Of course, even men undergo sexual abuse, but we'll focus on women now. So, sexual abuse at a very early age can predispose women to depression, anxiety, post-traumatic stress disorder, relationship issues, difficulty in modulating their emotions, controlling emotions, and so forth. This can also have various relationship problems and sexual dysfunctions in life. So, it's a very complex issue which needs to be evaluated. What happens in the society is that once the childbearing years are completed, the discussion about the reproductive health or the sexual health of men and women comes down, especially women comes down, because the focus is so much on taking up responsibilities. Procreation is over, so no more discussion regarding that. So this is what happens, and women also tend to talk very less about it and distress. They feel probably that the physician, their treating doctor, may not be receptive to that, or that it is a taboo to talk about that, and such problems. So I think everybody should um, consider this as a health issue, and which can lead to further problems, and take adequate care about this.
That's a good thing. See, I think sexual health problems can come out or present themselves as a frequent episodes of headache. As simple as that. The lady keeps coming to you just for a backache or a headache. Ultimately, when you evaluate, and there will be no cause for headache or backache. And then when you really evaluate, the hidden cause will be somewhere related to her sexual health. So that is, I think, definitely we need to think in women, because it can manifest in any form of the diseases. So I think with that, we have covered almost most of the women health issues in 30 plus.
As far as the sexual health is concerned, it's not only the sexual health of the woman, the erectile dysfunction and the sexual problems in men, the spouse as well, can lead to psychological disorders in women. And one more thing that I would like to stress upon is that revealing their psychological health, if they have any anxiety or depression, shall not be a stigma. So that they have to come out and they say that, yes, I have this problem, I need help from a psychiatrist or a doctor or whatever it is. So we need to remove that stigma from this society as far as the psychological health is concerned. We have many of our students who undergo a lot of stress. I see as a warden in the hostel, I see many of the youngsters, they come with so much of anxiety when they come to the medical college newly, adjustment problems, they go through a lot of stress and they'll end up with anxiety disorders and depression and so many things. And you provide them some amount of help. I'm sure, but Bindu knows about it. We have the support cell in the psychiatry department who counsel them. If treatment is required, they're treated for some time. It's not that once they start the antipsychotics, they have to take it for life.
and you're branded like a psychiatric patient. It's nothing of that sort. So we have to keep that also in mind.
We have almost covered all the health aspects of women to take care. When I was coming here, I saw behind an auto written, women are the most dangerous species on earth. I totally disagree with it. We are not dangerous, but we are the most complicated because our physiological system itself is so complicated that nobody can understand us. We ourselves don't understand. When our hormone behaves how, and based on that, our behavior will be totally dependent on that. And it's a good excuse also for us. If you shout unnecessarily at home, you can always say, today is my PMS, please cope up with it. And they say, okay, fine. Let me give her a day's time or 2-3 days time.
And
Let me
even
take
at
the issue
work.
after 3 days.
Even at work.
Even at work. At work, I think maybe you may not be able to express, ma'am, but that is understood. Understood. And even when I think people of older age, the professors or whoever it is, they're shouting, they say, oh, probably this lady is menopausal. Okay, fine. Let me just ignore that. That is what the response usually everybody gets. I think with this, our panelists have done a very good job in covering and giving you all the tips and tricks to take care of your health and how to prevent diseases, how to take care of your health and when to start and what all things to be done. So if the audience have any questions for the panelists, you are free to ask. I think we have.
For me, the medicine is laugh at yourself and laugh a lot. Okay? And laughter is the best medicine. And start laughing at yourself first.
Don't laugh so much that Bindu has to be called in. Yeah, both extremes are not good. So if there are no questions, I think I'll give any questions from the audience.
Thank you. It was a wonderful panel discussion. Basically, I have a question. I think Bindu ma'am can take it or anybody. Ma'am, how to deal, especially in workplace, I don't know whether it's appropriate or not, but because a clinical psychologist is sitting here, I just want to ask this question. How to deal in workplace? Especially it happens that, when we women tend to work together, there might be insecurities of another woman, which might project in various ways. So how to deal with that? Yeah, that's my question. Especially in workplace. Yes.
Why do you want to deal with her insecurity?
Yes, but then I totally understand what you're trying to say, that I have to deal with my insecurities. But then there is something that we share in common, where what happens even if I'm, for example, secure. But then, from the other side, because we have to work together, so, the work atmosphere becomes little toxic. So how to deal with that? Can there be little tips? For example, stay away, but then staying away might not help. Keep up to yourself. That might not help, because we have to have a conversation on certain things. We have to work together. Yes, ma'am. But then, when a professional is sitting here, why not take the opportunity?
So it can be a complex problem, especially at workplace. In fact, such situations could come up even at home or among friends. So we have to first understand the source of that problem. What is causing that person insecure, or what is leading to this complex situation? What is perpetuating the complex situation? So once we are able to understand the source of this need for validation on the part of that individual, then it might be easier for us to understand how to cope with that particular situation. So communication skills can be improved on, the way you communicate with the person, the social skills that you also have, the way you are able to communicate to that person about what is going on and what can be done in a more congenial manner. So that could solve some of the problems.
Always an explanation. Always better to go through, not in the terms Amy, this is a situation.
One more tip that I would like to give you is, if you people keep talking various things and we'll be discussing various things, and certain things might hurt you, isn't it? Suppose somebody gives me this, if I take it, it becomes mine. If I don't take it, it doesn't become yours. Somebody passes on a comment. If you take it, it hurts you. If you just leave it, no, don't take it, ignore it. That's the best. Whoever takes it will suffer. Don't suffer, don't take it. That's it. Sometimes it's difficult, but you have to grow strong enough to not
See,
take it.
I think ignoring is the best medicine for the best thing. Just ignore, keep doing your work. Definitely once you do your work properly, I think automatically the recognition comes your way. So ignore others, try to finish your work, concentrate on your work. I think that will be definitely helpful. Of course, a lot of problems will be there when two people work under one roof. It's there at home also, at workplace also.
Don't take the other person your competitor. You be your own competitor. Yesterday what I was, today I must be better than what I was yesterday. So don't compare yourself with others. They may achieve so many things. Okay.
So I'm Dr. Divya from the Department of Biochemistry. Thank you so much, because it was, this 1.5 hours was very wonderful, thought-provoking. And just a kind, humble request to Kokila ma'am, this should not be limited to, only once a year. Probably this should be an activity which should be conducted. Maybe you should ask the office staff as well as the faculties, seek permission from the institution to give them an hour off, come and attend such sessions once in 6 months, because this is more required, probably not limiting to because of the violence against women brought by the UGC. So usually we don't have women at the leadership, at the high leadership, especially in this policy making. When we have a women leader, I think would kindly request to keep this moving forward. I just wanted to add a point, not a question though. I have spent a decade in the US. So since we were talking about the maternity, and I also want to second the point which Dr. Preeti brought up. We always try to be a perfect mom, perfect wife, perfect daughter. Probably that's a conception which is deeply rooted in our culture. Right from the beginning, we taught we start teaching our daughters, not the son. So maybe when we are discussing as women in a forum, we also have to bring that point of sensitizing boys and men in our own family to start inculcating that culture that a girl or a woman as a life, she has a dream, a job, which when deeply rooted in the boys or men in the family, it becomes a culture of the society. And a stage like this will never be created that we sit and discuss women health, women career. This sort of platform should slowly deteriorate, bringing that culture at home. Second point is we were talking about the maternity. So I've spent a decade in the US. I went back to work right after 4 weeks, very healthily. This happens because in India, the culture of bringing up a child or a family is so limited only to the women. This starts in the family that it is your responsibility. But we talk about 6 months of maternity leave. The policy maker should also think of a paternity leave, where 3 months of maternity, 3 months of paternal leave is good, because the only cultural difference which I see is in India, the whole part of responsibility, lies with the women, and we are deeply cultured in such a way, it's your job, your job. Even a break of 1 hour to go to a parlor should become the right of women, because that gives a lot of mental peace, not just health. So such points have to be discussed in such forums, where girls start thinking that this is a very normal life. And the critical point that has to be made is self-care is not selfishness. Self-care is something that each of our girls should remember, that this starts from the family dinner table, where every time we start serving the men or the boys first and then we take over. No, make it a buffet system.
Let us eat together, stay together and live together so that all of us are being happy.
Work together also.
Yeah, work together also. And that we do without saying. So that culture has to be, largely spoken in forums where we sensitize people around us, especially the boys and the men. So that point has to be very much, taught at family. As women, I think we are responsible for bringing up family. So that is also, again, our responsibility.
I can very proudly say that
Yes.
I have brought up my son. I can tell my niece here, she will watch for it.
Okay.
He does every domestic chore.
Yes.
And
Slowly
he
the
shares
culture is
all
changing, I
the
do agree.
responsibility of my daughter-in-law.
Okay.
I tell him, you do more work because women are weaker physically.
Yeah.
Yeah. So he takes most of the responsibilities at home. So we women have to bring up our children, both boys and girls, and we should educate them to take equal
Yeah,
responsibility.
I think that term
And in
of
the-
physical weakness also we should start slowly bringing down in.
But
girls.
biologically,
Yeah,
we are made to be
physically, biologically, we are
made to be
Yeah,
weaker.
we are doing that,
Yeah.
or we are, because most of the responsibility is done by us. Because if I take up 80% of physical activity at home, obviously I become tired when compared to a man.
It's not only that you're
So-
tired, your hormonal makeup and biological makeup, you're weaker.
Yeah,
Women is weaker.
physiologically, biologically, yes, I do agree.
So they are weak, we are stronger.
Yes.
So we have to, keep the women power going.
Yes.
And I think overall, important is be healthy. Moment your health takes a beating, nobody really cares. So the whole here this forum discussion is be healthy, mind, body, and keep your soul and spirituality also healthy. Then nobody can do anything. You can perform any amount of tasks.
Thank you so much.
Thank you, Divya, for raising those two issues. I think there's one more.
Good afternoon.
Last question.
Yeah. So maybe my question is not exactly pertaining to working women. Maybe all women can be considered. Though STDs are most common in early adulthood, should women still worry about STDs in her 30s or 40s? Though menopause comes after 45s probably, and woman is still sexually active in her 30s. So should she worry about STDs? And if so, what are the screening there for STDs?
Yes, yesterday still, I think it's a big concern even right now. So of course, screening test, you have to go for a vaginal smears, regular examination, go for the examination as well as vaginal smear. And if any of the organisms are detected, get treated for it. And preventive measures for STDs, of course, you need to follow it once you start your sexually active life. I think that is the key message for it.
And one more important thing is many of the women who have STIs will be asymptomatic, especially chlamydia and gonorrhea. They'll be 80% of the women will be asymptomatic. They will not have any symptoms, but they still have the disease. So that we have to take care of some of the screening tests and some of the antibodies. When you're asymptomatic, we may not be able to detect the organism in the genital tract. Antibodies to those particular organisms may help us know that we're infected, and we take appropriate treatment. And that may affect even the pregnancy and the child if you happen to conceive.
One more problem is that nowadays a woman, as you said, since it is asymptomatic, and sometimes women doesn't even get to know that they are undergoing, they're having STDs. So I guess we should come up with programs which will let people know, let women know what will be the symptoms or how it all starts, so that they can take better care about themselves.
Yeah, I think that's the need. That's the need. We need to focus on that. Sure.
Thank you so much.
Thank you. Thank you, Mamta and the team for a wonderful panel discussion. It was a wonderful discussion, right from defining health, the concept of health, and the health index, the criteria, and a healthy mind by Dr. Bindu. And work and the stress levels and the health levels, not only in the working women and also in the homemakers. And all the panelists, they spoke about health issues related in women between 30 to 40 and 40 and above, and prevention, and when to start the prevention, and when you should really become aware of your health, and stress related to obesity and physical appearance, and the recommended screening tests at 30, and about the vaccines, and of course the bariatric and cosmetic surgeries. So you had a good feast from all the panelists. And at the end, I think I want to stress, as all of them told, all of you know that healthy mind is there in the healthy body. So you have to exercise. And Madam Pratibha ma'am said very little or just joked about meditation, but it is not a joke. Actually, Siddheshwar Swamiji says in the Pravachans, like Tanna Kudu, you just sit still. Like that, you forget you are a woman, you forget you are a 40-year-old woman, you forget you are a professor, you forget you are a wife, you forget you are a mother, and sit still for some time. So then you are going to give time for your soul. So meditation is not just you're going to think or concentrate only on your breathing or concentrate on one aspect. You just sit still. And traveling also it really helps. That's what I feel. Travel to very nice places and be with your friends, be with your relatives. And as Preeti said, everything in moderation. Everything in moderation, nothing in extremes. There is one way where Gautama Buddha said, Suvarna Madhyama Marga. For everything, it should be in moderation. And you know, Ati Adare, Amrutavu Visha, they say, no, whatever, even if it is good or bad, if it is more, it becomes poisonous. So everything in moderation, your exercise compulsory in moderation, and your diet again in moderation. I like ice creams, I eat more ice creams. It has a lot of carbohydrate. Everything in moderation will really bring you good health. And all the panelists have done wonderful job in praising you about the physical health, mental health, and the spiritual health also. So I thank Mamta and Pratibha ma'am, Bindu, Sumana ma'am, and Preeti for giving you a real academic feast on wellness of women. Thank you all.
Thank you, Vijaya Madam, for wrapping up the session. It was very nice. I mean, it was like how she put it across, academic feast for everybody. And lot of issues, probably you can take home, lot of messages, what they have told, spread it across to people at your own homes so that it becomes easier. We thank all the panelists as well as the chairman. I request Dr. Vijaya Madam, Chairman of Internal Complaints Committee of JSS Medical College, to hand over the token of appreciation to the moderator of today, to Dr. Mamta, Head of the Department of OBG. Thank you, ma'am. Your moderation was excellent. Thank you, Vijaya Madam. I request Dr. Manjula, Chairman of Internal Complaints Committee of JSS College of Pharmacy, Mysore, to hand over the token of appreciation to Sumana Madam. Dr. Katyani, Chairman of Internal Complaints Committee of JSS Dental College and Hospital, Mysore, to hand over the token of appreciation to Dr. Pratibha ma'am. Thank you, Pratibha Madam. Thank you, Katyayani Ma'am. I request Dr. Chanchala, Department of Periodontia, JSS General College and Hospital, Mysore, and coordinator for one of the ICC sessions, to hand over the token of appreciation to Dr. Preeti. Thank you, Dr. Chanchala. Thank you, Preeti Madam. I request Dr. Pallavi, who is a member of Internal Complaints Committee at JSS AHER, to hand over the token of appreciation to Dr. Bindu. Thank you, Dr. Pallavi. Thank you, Dr. Bindu. I request Kokila Madam, Member Secretary of Internal Complaints Committee of JSS AHER, to hand over the token of appreciation to Vijaya Madam, who was the chairperson of today's session.
I now request Dr. Divya Ma'am to propose the vote of thanks.
Gratitude can transform common days into Thanksgivings, turn routine jobs into joy, and change ordinary opportunity into blessings. Thank you is the best prayer that anyone could say, and I say that one a lot. Thank you expresses extreme gratitude, humility, understanding. And it is indeed my proud privilege to be proposing the word of thanks for today. We thank all of you for coming here today and making this event possible. As participants, you all have been a great audience. Thank you for your time and patience. I will be failing in my duty if I do not thank Suma Madam, the Chairman of Internal Complaints Committee, for organizing this workshop. Kokila Madam, the Member Secretary, who have taken immense trouble to see that the whole program goes in order. The top management of Pro-Chancellor Sir, our Vice Chancellor, Dr. Surinder Singh, our Registrar Sir, Dr. Manjunath, for being the pillars of strength for all these programs. I really owe it to my Department of Health System Management Studies, for the support that they have rendered here for today's program. I thank my student coordinators, Ms. Nayana, Ms. Sara, Ms. Aishwarya, Ms. Harini, Ms. Rashad, as well as Mr. Albin. A heartfelt gratitude to all of you all for standing up when we asked for your help. Thank you guys, and thank you audience for a great program. I once again thank the panelists for the wonderful job that they have done. Thank you one and all.